How to use a sphygmomanometer. This training video demonstrates the correct usage of the sphygmomanometer, including identifying its parts, preparing the patient, measuring blood pressure, and ensuring safety precautions. Let us first understand the main components. Scale, mercury column, air release valve, rubber tubes, inflation bulb, inflatable cuff. Inflatable cuff wraps around the patient's upper arm. Rubber tubes connects the cuff to the machine. Air release valve, a small screw knob on the bulb to slowly release air. Inflation bulb, pump, the rubber bulb you squeeze to push air into the cuff. Scale, markings alongside the mercury column, showing readings in mmHg. Mercury column, a vertical glass tube filled with mercury, used to measure pressure. Now, let us see how to use the sphygmomanometer on the patient. Before taking the reading, ensure the patient is seated comfortably with the back supported and feet flat on the floor. The arm should rest on a table at heart level, and the patient should relax quietly for 1 minute. Tight clothing around the arm should be removed. This is a sphygmomanometer, also called a manual BP machine. The set includes a cuff, a rubber bulb with valve and the mercury column for measurement. Unwrap the cuff completely before placing it on the patient's arm. Wrap the cuff snugly around the patient's upper arm, at the level of the heart. Just above the elbow. Close the valve and squeeze the bulb to inflate the cuff, until the mercury rises to about 200 millimeters of mercury. A stethoscope helps hear the blood flow sounds to measure blood pressure. Check the stethoscope by gently tapping the diaphragm to ensure it is working. Place the stethoscope gently on the inner side of the elbow, just below the cuff, over the artery. Now, open the valve slightly to release air slowly, and watch the mercury level carefully. The point where you first hear the heartbeat sound is the systolic pressure. The point where the sound disappears is the diastolic pressure. Together, this is the blood pressure reading. After measurement, release the air completely. Remove the cuff and fold it back neatly. Finally, place all parts back into the box, close it properly. And store it safely for the next use. Now, let us look at some important safety precautions to be followed. Handle the BP machine carefully, as mercury is harmful if spilled. Do not inflate the cuff too much, it can cause pain. Always use the correct cuff size for accurate reading. Release the air slowly to get the correct blood pressure. After checking, pack and store the machine safely.